Hey, what's going on, guys? Victor here from Cyborg for Life, and today I wanted to go over the physical therapy exercises you can expect to do after you get limb lengthening surgery done. Now, physical therapy is extremely important because as you lengthen the bones, the muscles and soft tissue are going to get really tight and taut, and it's important that you don't slack off if you want a good outcome, okay? So I'm going to go over the different exercises and stretches for the different areas of the muscles, such as the quadriceps, the hamstrings, the calves, the hips, and the glutes, okay? And then towards the end, I'm going to go over some tools that I think are going to be able to help you out as well, okay? All right, let's get to it. All right, guys, so we're going to start off with one of the most basic exercises you can do after you get out of surgery. It's going to be the lying knee extension. So what you're going to do is lay on your back flat, okay? And a lot of times after surgery, you're going to notice that your knees are slightly bent. That's okay. Your goal here is just to lay down flat, arms to the side, and you're just going to try to drive your knees into the mat or the bed or wherever you are, okay, and hold and squeeze those quads, okay? Hold that for about 5 seconds or so, and then relax. They may come back up, that's okay. Your goal is just to continue to do that for 15 to 20 times. So extend down, hold, and then back up. And then you're just gonna go back up like that, okay? That's gonna help get that knee extension working and strengthen those quad muscles. All right, guys, so the next one we're gonna do is the elevated knee extension. I'm gonna use a foam roller. You can use pillows or a pile of towels or something. Anyway, all you wanna do is lay down on your back. You wanna put the thing right below your ankles. And again, your knees might be slightly bent like so. After surgery, that's okay. We're just gonna use the force of gravity as well as our quadricep muscles to extend our knees straight. Hold it there for about 5 seconds, and then we're gonna let it relax, okay? Extend straight, hold. Again, you're flexing those quads, and then coming back up. We're trying to get this knee as straight as possible. We don't want this bend here. We wanna make sure those muscles are getting nice and pliable, okay? So hold, straighten, and then back up. Okay, guys, so the next one we're gonna do is the lying iso-lateral leg raise. So what you're gonna do is lay down flat on your back. You're gonna have one knee bent up, planted flat on the floor like that, and the other leg is going to be straight, extending that leg, flexing that quad, hands to the side, and all we're going to do is just try to lift this leg up, okay, keeping it straight, and then back down, okay? This is going to help strengthen that rectus femoris that crosses this hip joint, some of the other hip flexors, and the quad muscle, okay? What you don't want to do is keep this knee bent and then do this, okay? That's incorrect. You want to make sure that this is flexed straight, and then you lift it up like so. Okay, that's gonna work the whole quadriceps, especially that rectus femoris, and keeping that knee extension really working well for you. Below your knee, okay, knee joint and that popliteal angle, you're gonna lay down flat, okay? And what we wanna do here is just extend our legs up to flex our quads, okay? This gives us more range than if we did it flat on the ground, okay? This is a little bit more advanced. Again, it's not too hard. You wanna get up, squeeze those quads, and then back down. It's just strengthen that knee joint, working those quadriceps so that you can have that muscle control when you start moving around. The next one we're gonna do is gonna work on the knee flexion, and we're gonna do something called the heel slide. So what you're gonna do is lay down flat on your back, okay? And what we wanna do here, hands to the side, head down, all you're gonna do is just drag your heels up as far as you can and then back down, okay? So after surgery, it's gonna be pretty difficult. You might only go this far, that's fine. We're just gonna work on it as you get better. You wanna do about 15 or 20 reps of these, dragging them up, and then back down. The goal is to get as high as you can to where your heels are as close to your butt as you possibly can get, and then back down, okay? Okay, guys, so the next one we're gonna do is the prone leg curl, also known as the lying leg curl. So you're gonna lay flat on your stomach, if you're on your bed or the mat, whatever, or the physical therapy table, like so. You can prop yourself up with your arms, and the goal is to just kind of curl your legs up as high as you can, okay? Now, this may not be very high after surgery because it's pretty tough, you're swollen and everything like that, but just go up as high as you can, all right? And then back down, all right? Eventually, the goal is to get your heels as close to your butt as you can, and break that 90-degree angle, okay? It's gonna work, strengthen that hamstrings and increase that knee flexion range of motion. It's gonna look like this. So bring this knee up as close as you can to your chest. Now the goal is to keep this other leg flexed, okay, and straight as possible. You don't want to bend this knee and then do that. That's cheating. You want to make sure that this, so if I did on the other side, it would be this leg, okay, not bent. We don't want it bent. We want to keep it straight as possible. Flex that quad, Okay, extend that knee and then bring this other leg up as close as you can to your chest. Now I'm pretty tight, I could feel this already. I should be doing this more often, but the goal is not to have it here. You wanna break that 90-degree angle, perpendicular with your body, okay? Just like that, that's gonna increase your hip range of motion and strengthen a lot of those upper quad muscles. Work the abductor of the hip, and this is called the clamshell. So what you wanna do is just lay down like so, on the side, stack your legs on top of each other, make sure your knees are bent about 90-degree angle bend, and essentially just gonna kinda open up your knees like so. It's gonna work this outer hip here. Another one you can do for the outer hip, that abductor muscle, is laying on your side, keeping your legs straight this time, not bent. And essentially you're just gonna lift your legs out to the side like this, and it's gonna work that outer hip, the abductor muscle, which is super crucial and important for when you wanna walk normally. It helps you kind of move your legs for walking gait. But yeah, anywhere from 15 to 20 reps, one side, and then you're gonna flip over and do the other side. The hip bridge, some people call them. And what you wanna do is just, bend your knees at about a 90-degree angle bend, feet flat on the floor, hands are off to the side, and you're just gonna drive through your heels, okay, to elevate your hips up and squeeze your butt muscle, okay? Hold that for about 5 seconds or so, and then lower back down, okay? So push up, drive through, hold, back down. It's important to have those glute muscles really strong for when you want to walk normally. They're the biggest muscle in the body, so you want to make sure they're super strong. Next one we're going to do is the passive ankle dorsiflexion. So I have my little ankle strap here. You can get these in a belt strap type loop on Amazon, but I have the one that's a little bit more like a hook. Bend your legs, you can sit up for this one. You're gonna put it around the ball of your foot, okay? And you're gonna kind of hold on nice and tight and just kind of like pull back, okay? Get a stretch for about 5 seconds and then go the other way, okay? You wanna pull back, get as far as you can, and then go the other way. Now you don't wanna just yank on it because that's not gonna be good, especially if you just had your lengthening done, because that's gonna probably injure yourself. But as you go, like nice and slow, pulling it back, you can feel a stretch. That's all we're trying to do is keep that gastrocnemius and the soleus nice and limber. Another good stretch for the knee flexion and the hip extension is to use the strap while you're laying prone or flat on your stomach. And I'm gonna show you how to do that. So you're gonna lay down flat, okay? And you're gonna bend up legs as far as you can. Reach back with the strap, or have the loop of the strap, if you have that kind, the belt strap, around the top of your foot. And you're gonna just loop it there. And when you're ready, you're just gonna go ahead and pull as far as you can, pulling that foot up, okay? And I can feel a stretch in my quadricep. That's what you wanna do. And you wanna try to get that heel as close to your butt as you can. And another really good one from this position is to lift your thigh off of the floor, okay? And to stretch that hip, okay? So this is an extremely good stretch. It's gonna stretch the hip flexor, or the rectus femoris that crosses that knee, that hip joint, as well as the quad muscle, okay? So this is really, really important as you're doing femur lengthening. Another really good one for the hamstring stretch and the hip flexion is going to be laying on your back, like so. Then using the strap, you're gonna lift up. You wanna make sure that one leg is bent up, foot on the floor. The other leg is gonna be perfectly straight. You're gonna grab the ball of your foot with the strap or the belt loop, and you're just gonna go ahead and stretch back, okay, pulling back. Again, you wanna make sure that this leg is straight, and then you feel a nice stretch in the back of your thigh here, the hamstring muscles. Again, if you're having femur lengthening and you had the releases done on the IT band, you may feel a little taut and tight up here. That's okay. Just pull back, or the biceps femoris over on the outer side here. But I feel it right side on the inside here. But you want to hold that for about 10 or 15 seconds and then relax. Again, keeping this knee straight. If you bend it, you can come up all the way, no problem. But the goal is to keep that leg straight and then do it. And this is gonna stretch that hamstring muscle. All right, so another really good one for the knee flexion is gonna be sitting on an elevated PT table, or an elevated bed at home. And just sit on the edge there. Let your legs kind of dangle down about a 90-degree angle. And you just go ahead and try to bring your legs back underneath you, okay, past that 90-degree angle bend. If you have trouble doing that, you can either use the other leg or use your hand as assistance to bring this leg back, okay? And that's gonna increase that knee flexion range of motion. And on the other side, the flip side, you could do it for the knee extension by, kicking your legs out, okay, to straighten your legs, okay. And if you wanted to use the other leg to help with that, or your hand to kind of help it get up there, that's all really good to increase that knee extension. Okay, so guys, I have a calf slant board here. This one goes from 10 degrees to 20 degrees to 30 degrees and even up to 40 degrees, which is really, really intense. But this is really good to increase your dorsiflexion and stretch out your gastrocnemius and your soleus, as well as your Achilles tendon after tibial lengthening. So right after surgery, you're going to probably put it at 10 degrees just to see if you can get past neutral, which is standing on the ground flat. But you'll just stand here. You'll just stand on the board, okay? And from here, you can even do some exercise. You can do calf raises if you have a strong enough nail that's supporting full weight bearing. This is really good to increase the strength there. But then as therapy goes on over the couple of weeks, you're going to go 20 degrees. Okay, again, they'll probably have you hold it here, start to feel the stretch in your muscles and your tendons. And you can even do calf raises from here. And then 30 degrees, which is getting more intense. Okay. Again, hold yourself onto something because it's getting like a steep slope. And it has some tack there, so it's easier to hold on to. But I can feel that stretch pretty good if I'm trying to. And again, you want to make sure that your knee, okay, your knee is straight. You don't want your knee bent because that's easy, okay? You want to make sure that your knee is straight, okay, for the gastrocnemius, okay, because that crosses the knee joint back here. So if you have your bent knee, you're going to be stretching the soleus, but not the gastrocnemius. So extend that knee, make it straight, and then you can do your calf raises from there. And then finally, the big bad boy. All right, this one is going to be a 40 degree. Oh yeah, I can feel that. In fact, my heels aren't even touching the slant board, so I'm somewhere between 30 and 40 degrees, and doing calf raises from there is probably a little dangerous, so I'm not going to do it. But again, if you want to stretch the soleus from here, just do it one leg at a time. I recommend put it on a higher angle, bend the knee for the soleus, and then you can stretch into it because that is down here. It lies underneath the gastrocnemius, and it's a really good stretch there. As you can see, it's going to really stretch that out. So that's really good for if you get tibial lengthening done and you want to keep that dorsiflexion going on so you can walk normally, after surgery. All right, so I'm going to show you some of the tools that I think that are going to be helpful to you, later on in your therapy. Probably not right away. Stretching and doing the exercise is going to be the most beneficial then, but later on as you're trying to rehab and rebuild, some tools such as a foam roller is going to be helpful. This is just your typical styrofoam foam roller. It's pretty firm, it doesn't give. This one made by OPTP. But anyway, you're just going to kind of put it on a mat or a flat surface. And this is good for the, the quadriceps, loosening up that fascia, okay, myofascial release. So putting pressure on your leg initially is not a good idea, but after the bone has consolidated, it can be beneficial to increase blood flow, release the fascia, and help you loosen up that soft tissue, the muscles and the fascia. So you're just gonna kind of roll. Okay, this is really good for the IT band, okay? And you can do it on the quadriceps as well. Both. And you can do it on the hamstrings, okay? Now, that's pretty aggressive. There's one that's more aggressive. This one here with the little knots in it. It really helps to break up the scar tissue and the adhesions that you may have, as well as, like I said, releasing that fascia. And then if you don't want to go so aggressive and use your own body weight, there's a little, roller stick that does the same thing you can do manually. You can just kind of use it on your quads with light pressure, but it still increases the blood flow, loosens up that fascia, which is that sheath that surrounds the muscle, and that can really help. You can even use it on your calves in tight spaces. This is really good. Believe it or not, this is what I did to help me rehab and rebuild later on. All right guys, so that's most of the exercises and stretches you can do for physical therapy after your leg lengthening surgery. So some of the tools that you can use, you saw this already, this is the strap. They also come in a belt format where you can loop it around, and you can get it on Amazon or wherever, but this is really good for increasing dorsiflexion, for tibial lengthening, also stretching out the hamstring, for femur lengthening, and the quadriceps as well if you're laying down prone, and the hip extension as well. So really, really good tool here. I showed you the foam rollers, okay? So you have the roller stick. This one is a manual. It's really good for tight places. So you can use it on your quads, your hamstrings, your calves, you know, all those different areas. Really good little tool there. Then you have, like I showed you earlier, the foam rollers, okay? This is the cylindrical foam roller. It doesn't give. There's some that gives, you know, you don't want that. But again, this is gonna be later on in your therapy, not right away. Make sure the bone is consolidated so you don't wanna be putting too much pressure. If not, but really good tool here. And then you also have the same foam roller, but it has divots in it and it's really, really sturdy. This one digs deep and it hurts like crap, but I like this for, you know, warming up and increasing that, like that blood flow and loosen up the fascia. And then what else? Yeah, the calf board. Here we are. So you guys saw this one, the calf board, really good. It's a tri-fold, so it kind of opens up like this. You got the 10-degree mark, the 20-degree, you got the 30-degree, and you even have the 40-degree right here, okay? Really good for increasing that dorsiflexion and doing some calf raises on that to increase your calf strength, okay? This is gonna help you walk a lot faster because if you can't dorsiflex, your foot's gonna hit the ground. And this is gonna prevent a lot of things like drop foot and all those things, okay? What else here? Yes, last but not least, the massage gun. So this is a percussive massage gun. It comes in a little kit like this that has, you know, the charger and different little attachments for different areas of your muscles. Really, really good tool. I use this before leg day every week, sometimes twice a week. In fact, I use it on all my muscles. But basically it has 5 different settings and you just kind of turn it on. It'll light up and that's level 1, 2, 3, 4, 5. And basically you can use this on your legs, okay? Your calves, hamstrings. You can use it on your upper body if you get tight from sitting for too long, your neck. Yeah, everywhere. And basically it just helps you to get really deep into the muscles, increase blood flow, and break up scar tissue so that you know, you can get more range of motion and stretch out those tissues. Okay guys, so this is a percussive massage gun. This one is the Ekron. See if I can show it in there without it showing my face. It probably won't. It won't focus my camera. But anyways, the Ekron D37. I got it on Amazon. I don't know if it's still on Amazon, but you can get any real percussive massage gun. It doesn't really matter the brand, but this is a really effective tool. I think this is a secret weapon and it's going to change the game in terms of physical therapy. I think they better be using this if they're not using this. So all physical therapists, get to it. All right, guys. Hey, that's all I have for you guys today. I hope you enjoyed the video. So you got to understand that physical therapy is super, super important. You cannot slack off. If you are dedicated and determined to get leg lengthening done, and you're not a hard worker, start working hard now. Start working out, increasing your habits, your healthy habits, your stretching habits, things like that, because you need to get into the habit of doing that so that when you get the surgery done, you're willing to put in the extreme effort and the rigorous training or the therapy that's needed to for a successful outcome, okay? Because it's not a joke. It is not a joke. I like to joke around a lot, but it is gonna be grueling. You're gonna feel some toughness. Some guys are gonna be more flexible than other people, but you gotta realize that it's gonna take a lot of work and consistent effort on your part to come out after getting your length, okay? All right, guys, that's all I have for you today. Hope you enjoyed the video. If you did, hit that like button. Be sure to subscribe, and until next time, this is Victor from Cyborg for Life, signing out.